This video provides an overview of the Kentucky Health Information Exchange's lab data entry functionality in the ePartner viewer. In this video, I will demonstrate how to create ordering provider and ordering facility details and how to complete positive COVID-19 lab data entries in the ePartner viewer. Please note that all examples in this video are simulated with mock data and no protected health information or PHI is present. To start using the lab data entry functionality, log in to the ePartner viewer and click the Lab Data Entry tab in the blue navigation bar at the top of the screen. The Lab Data Entry drop-down menu includes the following items: COVID Lab Data Entry. This option is best utilized when you are entering positive COVID-19 lab results. It allows you to enter multiple test results at the same time for the same patient. Next is the quick entry for negative COVID-19 test results. This option is best utilized when you are entering negative COVID-19 lab results. It allows you to enter up to 10 different patients with negative test results at the same time. Please note, quick entry for negative COVID-19 test results is covered in a separate video. The Lab Data Entry User Report provides a quick and easy way for you to review previously entered lab results from a given time frame. The Manage User Preferences option provides an efficient method for you to include your ordering provider and ordering facility details. Setting these preferences allows you to quickly select an ordering provider or ordering facility from the drop-down options, instead of manually entering the ordering information with each individual lab data entry. These drop-down options are located on the Provider Details screen for COVID lab data entry and also on the Observation screen for negative lab quick entry. Prior to entering your lab results, you are required to enter information about your ordering provider and ordering facility on the Manage User Preferences screen. From the Lab Data Entry drop-down menu, select Manage User Preferences. Then select Create Ordering Provider Details. To create an ordering provider, enter the provider details in the mandatory fields marked with asterisks. If known, select the appropriate prefix from the drop-down. Enter the ordering provider's first name and last name. If known, select the appropriate suffix from the drop-down. Enter the ordering provider's address, city, state, and zip code. Enter the provider NPI. If known, enter the ordering provider's phone number. After completing the mandatory fields, click Save. The Create Ordering Provider Details pop-up displays to show that the information has been saved successfully. Click OK to proceed to the View and Edit Ordering Provider Details screen. To edit an ordering provider's details, click the Edit icon located next to the appropriate ordering provider. In the Update Ordering Provider Details pop-up, you may edit the appropriate fields. When finished, click Save to save the updates. Then click OK to close out of the pop-up. To delete an ordering provider from the user preferences, click the trash bin icon located next to the appropriate ordering provider. To delete the ordering provider, click OK. Click Cancel if you do not want to delete the ordering provider. To search for a specific ordering provider in the user preferences, click Apply Filter. Search by entering the ordering provider's name, NPI, address, city, state, zip code, and/or phone number in the corresponding filter fields. Now that the ordering provider has been created, let's create an ordering facility. To create an ordering facility, click the Lab Data Entry drop-down menu located in the blue navigation bar at the top of the screen. Select Manage User Preferences. Then select Create Ordering Facility Details. The Create Ordering Facility Details screen displays. Enter the ordering facility details in the mandatory fields marked with asterisks. Enter the facility name. Then enter the facility's address, city, state, and zip code. If known, enter the ordering facility's phone number. After completing the mandatory fields, click Save. Click OK on the pop-up to proceed to the View and Edit Ordering Facility Details screen. The View and Edit Ordering Facility Details screen functions the same way as the View and Edit Ordering Provider Details screen. Using the appropriate icons on the left, you have the option to edit and delete the ordering facility details. You can also click Apply Filter at the top right to filter the list of facilities by facility name, address, city, state, zip code, or phone number. Now that we've created an ordering provider and facility, let's start lab data entry. Before entering lab results, please review these tips for manually entering lab data. There are mandatory fields marked with red asterisks. These fields must be completed in order to proceed. In addition to completing the mandatory fields, please enter as much information as possible. Help icons are available to help guide you while entering data in the fields. For entering address information, all states are available for selection in the State field dropdown. When you select the state of Kentucky, all Kentucky counties are available for selection in the County dropdown. However, when you select any state other than Kentucky, the system will display the message Out of System State and will not display counties in the County dropdown. Please note, the Kentucky Department for Public Health does not report test results to other states. If you are required to report results to other states, you are responsible to do so. COVID lab data entry is a 6-step process where you enter patient information, observation results, provider details, and enter answers to specific questions asked on order entry. The lab data review screen requires you to review the accuracy of the information you've entered. The final step is submitting the COVID-19 lab data entry. To start entering positive COVID-19 test results, click Lab Data Entry in the blue navigation bar at the top of the screen. Then select COVID Lab Data Entry from the drop-down menu. The first section of the COVID Lab Data Entry is the patient information screen. Select the performing facility name from the drop-down. This will be the name of the organization that resulted the lab for which you are entering results. This is usually the name of the organization that you are associated with. Enter the patient's medical record number. A medical record number, or MRN, is an organization-specific, unique identification number assigned to a patient by a healthcare organization. If your organization does not use an MRN, you must create a way to uniquely identify your patient so that the patient is registered in the KHI system. Enter the patient's first name and last name. If available, enter the patient's middle initial. Then enter the patient's social security number. Enter the patient's date of birth by entering 2 digits for the month, 2 digits for the day, and 4 digits for the year. Or select the correct date from the calendar. You should ensure that you are selecting the correct year when using the calendar function. If a patient's age is under a year old or more than 100 years old, a notification pop-up will display to confirm the correct birth year has been entered or selected. For this example, we will show what happens when the incorrect birth year is selected. Select the patient's sex from the drop-down. Then select the patient's race and ethnicity. Now enter the patient's street address, city, state, zip code, and county. You should enter the patient's home address. However, in cases of congregate care, you should enter the address of the nursing home, group home, or similar congregate care facility. You can hover over the help icon to assist with entering the correct address information for the patient tested. Please note, when entering the test results of facility employees, please enter the home address, not the work address. If available, enter the patient's 9-digit phone number and email address. If the phone number or email address is not in the appropriate format, a pop-up notification prevents you from proceeding to the next page until the format error is fixed. As mentioned, if a patient's age is either under a year old or more than 100 years old, a notification pop-up will display to confirm the correct birth year was selected. This notification pop-up displays when you click Next. If the date of birth is correct, click Yes to proceed. If the date of birth is incorrect, click No to make a correction. Once the patient information section is complete and the correct birth year has been confirmed, click Next to proceed to the observation screen. On the observation page, you must select at least one of the options available for ordering details, either the ordering facility or the ordering provider. Please note, if you do not select at least one facility or provider, you cannot proceed to the next page. While it is not required to select an ordering provider and an ordering facility, you are encouraged to select an option for both sections if you have the information available. The drop-down options display the ordering provider and ordering facility details entered by the user on the Manage User Preferences screen. Select at least one of the options available from the drop-downs in the ordering section, facility name and/or the provider name. When you select the provider name, the provider NPI field automatically populates. In the observation section, enter the filler order number or lab accession number. The filler order number or lab accession number is typically utilized by laboratories. This generally refers to the number assigned to a lab sample when it is checked in. If your organization does not log the receipt of specimens, you should create a system to uniquely track the specimen when you check it in. Enter the date test ordered. Then enter the specimen collection date. Select a specimen type from the drop-down. This is the method by which the sample was obtained. Note, if you administered the BinaxNOW COVID-19 test, please select anterior nair swab as the specimen type. Select the appropriate test type. To assist with selecting the appropriate test type, click the Select Test Type hyperlink to view a list of test types and test names. The test type category pop-up displays a categorized list of test types and test names. To filter the list, click Apply Filter. Enter the appropriate test type in the field to refine the test type results. To further refine the results to a specific test name, enter the appropriate test name in the search field. Click OK to close out of the pop-up. Select the appropriate test type by clicking one of the radio buttons. The test name drop-down will only display test name options that correspond with the selected test type. Select the appropriate test name from the drop-down if applicable. Please note, when BinaxNOW is selected as the test type, the test name field is disabled and auto-populated with BinaxNOW COVID-19 test kit. Select the test result from the drop-down. Please note, if you select Other from the test result drop-down, you must enter the reason in the Other Reason Value field. An example could be a test result description that is not listed in the drop-down, such as undetected. You would select Other and enter the test result as undetected. Next, enter the observation result date. Please note, the specimen collection date cannot occur after the observation result date. The specimen collection date must occur on the same date or any date before the observation result date. If you enter a specimen collection date that occurs after the observation result date, then both fields are marked as invalid. If you click Next, the observation screen is grayed out and displays a banner message. To proceed, you must enter a valid specimen collection date that occurs on or before the observation result date. If available, enter the name of the testing product, which is the platform used to perform the testing. If available, enter the device identifier, which is a unique ID given to the specific device that was used to perform the testing. For example, the device's serial number or barcode number may be listed here. You have the option to log the details for multiple observations. This means that you can easily enter additional test results, positive or negative, on the same patient. To add another observation, click Add Observation. Then select the test type and test name for the additional observation. Select the test result. Then enter the observation result date. The name of the testing product entry on the first observation auto-populates in the subsequent observations. However, you can edit as necessary. If available, enter the device identifier. To delete an observation, click the trash bin icon located at the top left. Click the minus icon on any of the observations to hide or display the details for that observation. Click the plus icon to display hidden observations. Once all additional observations are entered, click Next to proceed to the Ask on Order entry page. The Ask on Order entry page is where you can enter answers to questions that healthcare providers may ask patients regarding COVID-19 testing. Select the appropriate answer from the first test dropdown to report whether this is the first time the patient has ever been tested for COVID-19. The objective is to find out whether the patient has ever been tested anywhere, not just at your organization. Select the appropriate answer from the Symptoms dropdown. Hovering over the Help icon provides guidance for reporting whether the patient has symptoms. If the patient meets the guidance for reporting symptoms, select Yes. When you select Yes, you must enter the date of onset. This is the date that the symptoms began. If the patient does not meet the guidance for reporting symptoms, select No. This disables the onset date field. Select the appropriate answer from the ICU dropdown to report whether the patient has been admitted or transferred to the intensive care unit. Select the appropriate answer from the HCW dropdown to report whether the patient is a healthcare worker. Select the appropriate answer from the hospitalization dropdown to report whether the patient has been hospitalized. Now select the appropriate answer from the congregate dropdown to report whether the patient lives in a congregate care setting. The pregnant field is only enabled when the patient was marked as female on the patient information screen. If applicable, select the appropriate answer for pregnancy. Then click Next to proceed to the Lab Data Review screen. The Lab Data Review screen displays a summary of the information you've entered. You should review this screen to verify the accuracy of the information prior to submitting the lab results. Review the Patient Information section. You may click the header of any section to hide or display the details for that section. Next, review the Ordering section and the Observation section. And finally, review the Ask on Order entry section. If changes are required, click the corresponding hyperlink to navigate to the appropriate screen or section to edit the information. You can also click the section header hyperlink to navigate to the appropriate page. For example, upon clicking the Ask on Order entry hyperlink in the section header, you will be navigated to the Ask on Order entry screen. If multiple observations are entered, you can click the appropriate numbered observation hyperlink to navigate directly to the specific observation. For this example, click the Observation 2 hyperlink to navigate directly to the Observation 2 section. Once the appropriate edits are completed, click Next until you navigate back to the Lab Data Review screen. After verifying the information is accurate and/or the appropriate changes have been made, click Submit to submit the lab data entry. All data submissions are final. Select Cancel to continue reviewing the lab data entry, or click Submit to finalize the lab data entry. Click OK when the lab data entry has been submitted successfully. Please note, once a lab data entry has been submitted, it is final. Should you later discover that you have entered inaccurate information, please reach out to the Kentucky Department for Public Health at covid19dr@ky.gov to determine options for correcting the entry. Congratulations! You have submitted a manual lab data entry using KHI's Direct Lab Data Entry functionality. For additional training resources, such as the Direct Lab Entry User Guide and the Quick Entry for Negative COVID-19 Test Results training video, please visit the KHI website at khi.ky.gov. Thank you for watching this demonstration.